New at 10, it's considered one of the biggest scandals in state history. Reckless rehabs targeting vulnerable Native Americans, all to get billions of dollars from the state's Medicaid system. We've been tracking this story for years, and now we've learned what changes have been made to stop the fraud and abuse. 12 News journalist Chase Golightly is live at the state capitol, where lawmakers questioned leadership at Access, where the funds come from. Chase?
Mark, that's right. Leaders with Access spoke in front of the Senate Health and Human Services Committee about the changes they made to combat that fraud. They also talked about some of the firsthand experiences they've seen investigating these homes.
We've witnessed people living in closets.
Access Inspector General Vanessa Templeman telling senators what her teams have seen at fraudulent sober living homes.
Back doors being barred, services not being provided.
These reckless rehabs in some cases using white vans like this to pick up Native Americans struggling with addiction, promising them booze and drugs for signing up for Arizona's American Indian Health Program. Also, these fraudulent providers can get Medicaid money without providing proper treatment. In some cases, it led to patients dying.
The fraud we have seen rip through the behavioral health landscape is staggering.
This went on for years, costing Arizona taxpayers $2.8 billion, according to lawmakers. Now Marcus Johnson, the deputy director for Access, addressed changes they've made to prevent the problem, saying it led to serving 11,000 patients, giving 4,000 temporary housing, with 129 patients asking if they can be sent back to their home state.
This fraud was so rampant that people were actually being recruited here from out of state.
They've also created a missing person location system. If someone is reported missing to police, officers can now contact Access to see if they're in its system. Access also introduced a new audit force to look into facilities, requires providers to fill out additional documentation and verification processes, as well as tracking data to make sure certain codes aren't being abused. Johnson says these changes are working, showing that since 2023, reimbursement amounts have gone down significantly, saving close to $1 billion. Enrollment in the American Indian Health Program also dropped significantly from these changes, because many enrollees were not Native American. While the state has suspended more than 300 licenses, charged and convicted some providers, Nikki Forty, an addiction and rehab specialist who is very familiar with how Access works, believes these changes should have already been in place.
A lot of providers I talk to say should have been caught a long time ago.
Forty also told me it's going to take a very long time to rebuild the trust with actual providers, saying those actual providers are going to have to prioritize transparency and accountability moving forward. We're live in Phoenix tonight. Chase Golightly, 12 News.
Chase, thank you.